When Janice got diabetes, I didn't know much about diabetes. And even when I took her for the service for treatment, they didn't know much about it. It's not an easy life, honestly. So it's an up and down life. That is kind of hard if you're not prepared for it.
After she was diagnosed with type 1 diabetes, I as a parent was so frustrated. I was full of anger. And I thought that was end of Janice.
So the camp really helps to prepare you for diabetes and the life ahead of it.
Care Diabetes Management and Information Center has been arranging camps for children for the last, I think, since about 2008. And today we're here in Embu at a camp for children with type 1 diabetes and their parents.
These camps have given us a big, do I call it advantage in terms of improving diabetes care among the family members.
I know when we first started, we used to have camps just for children. And we realized there's really a need for parents to come together, share their challenges, realize we're not alone. And I think for them it was a big relief, just to realize that the children can learn how to manage for themselves and they can have fun like any other child, so long as they know what to do.
You feel at home because you're not the only one injecting yourself, you're not the only one doing the blood sugar. So it's really welcoming.
It has shown me that diabetes is not a disease. It's just but a condition, a lifetime condition. With proper management, you'll just live with it and you can go far and have so many years and excel.
And the girls run in and say, "Mom, we've injected ourselves today and it doesn't hurt." And the mothers were like, "Okay, you can do it? So I no longer have to inject you?" And I said, "Yeah, but everybody here does it for themselves."
Come on! Let's go!
I mean, insulin is essential. They cannot live without insulin. But the education that goes with the insulin, the issues of diet and how the impact of diet on blood sugar control, physical activity, and just a whole rounded education about how to manage type 1 diabetes, that is critical. So we're really thankful to WDF for funding the program and also to Novo Nordisk for the CDIC program, which has really made a difference in the life of the children living with type 1 diabetes in Kenya.
We have about 5,000 to 10,000 children with diabetes in Kenya. But in our system, the counts that we are currently following up, they are only about 2,000 or 2,500, meaning that the rest of the children out there, most of them will die in the wards or they will live a miserable life because nobody knows that these children are lacking insulin.
But we realize there are many more children in the country who do not have access to this program. So with the Minister of Health, we continue to see how best we can try and reach every child with type 1 diabetes in Kenya.
We are training healthcare workers so that when they see a child coming to the ward, they will think about diabetes even before thinking of other diseases like malaria or pneumonia or severe malnutrition.
I really wanted my son to realize that having that condition, one can excel in education and he can become a person in the future.
It's important to have them here because they're the closest support system you have. So in case of anything, they understand it. As much as they don't feel it, they get it.